We are going to do a physical assessment on our friend Mr. Smith. I have knocked on the door, gained entry, introduced myself, and explained what we are going to do. So I am going to wash my hands and identify my patient. Can you tell me your name and date of birth? Okay, and I am checking that against his armband. I'm going to raise the bed to a comfortable working height. And I've already started assessing his orientation, so I'm going to ask him some questions to further that assessment. Do you know where you are, Mr. Smith? Okay, and can you tell me today's date? Great. And what season is it? Perfect, okay, so he is alert and oriented times 4. Next, I'm going to drop my side rail so I don't have to lean over it and assess the top of his head. I'm looking at the skin, I'm looking behind the ears to make sure that there's no breakdown. I'm feeling in his scalp, assessing the color of his skin, the temperature. I'm then going to assess his pupils. With the lights on, I can check what size the pupils are, make sure that they are equal in size. And we're about 4 millimeters. Then I will turn the lights down and tell my patient I'm going to shine a light in their eye and start on the outside and shine in at an angle. And you're looking for that pupil to get smaller, dilate, to constrict. Okay. Pupils are equal and reactive to light. I'm now going to check his mucous membranes. So I can use my light to look into his mouth, have him open up, checking the color and the moisture of the mouth and the nares. Checking on any dentition. Does he have any missing or loose teeth? Is he wearing dentures? Making note of all of that. Next, I'm going to assess his arms. So I'll lift up on the gown so I can see the full skin of his arms. Looking for any abrasions, bruising, cuts, color changes. Feeling the color of his skin. I'm going to pinch the forearm to assess his skin turgor. I can also do the top of the chest if the arm skin is loose. And then I will feel his pulses, his radial pulses at the same time. I am looking for regularity and strength, and I'm comparing them against each other. Okay. And then I will check his fingers for capillary refill, pinching just the top and watching this color come back. It should be in less than 3 seconds. I'm gonna do that in both hands. All right, and then I will assess his strength in his hands. I like to cross my fingers because if you hold them like this and your patient is actually quite strong, it can hurt. So go ahead and cross your fingers and have them squeeze. Perfect. Okay, and then I will move on to the chest. Going to instruct my patient to take deep breaths as they feel my stethoscope hit their chest. You want to assess them taking a breath in and out at each location, listening to the intercostal spaces, not right on top of a rib, and making sure that your stethoscope is on their skin. Go ahead and take a deep breath in and out, in and out. Go ahead. In and out. In and out. Good. I'm also taking note of the color and the skin integrity on the chest at this point. Now I'm going to put his head of bed down so I can assess his posterior lung sounds. Remember to lift this knee up so it's more comfortable for him to turn. And use that arm to grab the side rail. And up on the side. We can pull him toward us a little if we need to. Now we are going to do the posterior lung sounds and the back of our patient's body. I like to just turn my patient the one time so that they're not going back and forth. So I will assess the whole posterior side at the same time. We've already turned our patient. We'll go ahead and listen to his posterior lung sounds. All right, Mr. Smith, go ahead and take a breath in and out. 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 And one more time. In and out. Good. I've taken note of what his lungs sound like, and we're looking for clear sounds, wheezing, crackles, rhonchi, anything like that is what you will document. I'm also looking at the skin on his back to make sure it's intact. I will then move down to his buttocks, and I'm going to put gloves on for this. Okay, lifting up to make sure that there's no redness, and I do see a little redness here. You can push on it to see if it blanches, which means the color drains and then comes back. I'm also checking the backs of his legs while I have him over here, checking the heels to make sure there's no skin breakdown there. Good. Okay, Mr. Smith, we're going to turn you back onto your back. I'm going to listen to his heart. Keeping as much privacy as possible, but remembering to put my stethoscope to the skin, not on top of a gown. Going to listen to the apical, the pulmonic, the tricuspid, and the mitral. And I'm going to stay here for 60 seconds to count his pulse at the apex, count his heart rate. Okay. And then we'll move on to the abdomen, covering up the chest. First, I'm inspecting. I'm looking to see if the abdomen is flat, if there are any bulges or scars, anything like that. And then I will auscultate. Starting in the right lower quadrant, the right upper quadrant, using the belly button as a guide, the left upper quadrant, and the left lower quadrant. Making sure I'm hearing sounds in each one before I move on. And then I'm going to palpate. I'm going to push down softly at first, making sure that the whole abdomen is soft, there's no hardened masses, and then push down a little harder. Are you experiencing any pain when I push down, Mr. Smith? No? Good. Okay. And we can assess the genitalia, making sure it's intact. And then we'll cover him up. We've now moved on to the lower extremities. I'm going to take a look at the skin, assessing for color, temperature, intactness. Also assessing the back of the calves if I didn't do that on the other side, looking for any redness, warmth that would indicate a blood clot. I'm going to feel for his pulses. The pedal pulse is going to be somewhere on the line between your big toe and the side of your ankle. And feel for those at the same time so you can assess if they are equal, looking for regularity and strength. We're also going to feel for the posterior tibialis, which is the inside of your ankle, just right behind the bone, feeling those at the same time. We'll do capillary refill on the toes, same as the fingers, squeezing and watching that color come back in, should be less than 3 seconds. Going to push down on the foot to assess for edema and on the shin. And we'll do that on both legs. And then we'll assess the strength. So I'll have him push down like you're driving a car. Okay, good. And then pull up like you're pointing your toes towards your nose. Perfect. Okay, Mr. Smith, that concludes our physical assessment. Do you need anything at this time? All right, well then I will make sure the side rails are up. I will lower the bed completely, wash my hands, and document.